It sounds like you like some help with creating music using.
Hello everybody, how is you? Today I am going to show you about a burn injury and its management for you and your families. Now you just heard in watching this video. A burn injury is damage to the skin or other tissues caused by heat, chemicals, electricity, sunlight, or radiation. The severity of a burn depends on how deep the damage goes and how much of the body is affected.
It sounds like you like some help with creating music.
There are 5 types of burns by cause. Number 1 is thermal burns. It's caused by exposure to high temperatures. They result from contact with 1. Hot objects, for example metal, glass. 2. Flames or fire. 3. Scalding liquids, like boiling water, hot oil, or steam. 4. Explosions that generate intense heat. How thermal burns happen. When the skin is exposed to heat, it causes damage to the skin cells and underlying tissues. The severity depends on the temperature, duration of contact, and area affected. Number 2 is chemical burns, caused by acids, alkalis, or corrosive substances. Also known as caustic burns are injuries to the skin, eyes, mouth, or internal organs caused by contact with a corrosive substance such as a strong acid or base. These burns can result from direct contact, inhalation, or ingestion of harmful chemicals. Common causes of chemical burns. Household cleaners, example bleach, ammonia, drain cleaners. Industrial chemicals, example acids like sulfuric acid or bases like sodium hydroxide. Battery acid. Pool chemicals. Hydrofluoric acid, used in some industrial processes. Number 3 is electrical burns, from contact with electrical current or lightning. Electrical burns are injuries caused by the passage of electric current through the body, which can damage skin, muscles, nerves, and internal organs. These burns can be deceptive. The external injury may look minor, while internal damage can be severe or even life-threatening. Number 4 is radiation burns. Radiation burns are skin and tissue injuries caused by exposure to high levels of ionizing radiation, such as from nuclear accidents, example Chernobyl, Fukushima. Radiation therapy for cancer. Industrial accidents involving radioactive materials. Improper handling of radiation-emitting devices. Number 5 friction burns. It is friction burns are skin injuries caused by rubbing against a surface. They're a combination of an abrasion, scrape, and a thermal burn from the heat generated by friction. Common causes include falls on rough surfaces, like roads or treadmills, clothing rubbing during intense activity, or skin contact during certain physical activities. Symptoms of friction burns. Red, raw, or blistered skin. Pain or tenderness at the site. Peeling or bleeding, in more severe cases. Possible infection if not properly cleaned.
It sounds like you like some help with creating.
They have 4 degrees of burns. First degree, superficial. Affects only the outer layer, epidermis. Symptoms, redness, pain, mild swelling, like sunburn. Heals in a few days without scarring. Second degree, partial thickness. Involves the epidermis and part of the dermis. Symptoms, blisters, intense pain, swelling, moist/red appearance. May heal with scarring. Third degree, full thickness. Destroys both the epidermis and dermis, may extend to fat, muscle, or bone. Symptoms, white, charred, or leathery skin, may be painless due to nerve damage. Requires medical treatment and often skin grafts. Fourth degree. Extends through skin, fat, muscle, and even bone. Life-threatening and requires extensive treatment.
It sounds like you like some help with creating.
First aid for burning at home. First aid for burns at home depends on the severity of the burn. Most minor burns can be treated at home. Here's what you should do immediately. First aid for minor burns, first degree or small second degree burns. 1. Cool the burn. Immediately run cool, not cold, water over the burn for 10 to 20 minutes. Alternatively, apply a cool, wet compress if running water isn't available. 2. Remove tight items. Remove rings, watches, or tight clothing before the area swells. 3. Clean the area gently. Use mild soap and water. Pat dry with a clean towel. 4. Apply a burn ointment or aloe vera. Use aloe vera gel, burn cream, or an antibiotic ointment, like Neosporin. Avoid butter, oils, or toothpaste, they trap heat and may cause infection. 5. Cover the burn. Use a non-stick, sterile bandage or clean gauze. Change the dressing daily. 6. Pain relief. Take ibuprofen, Advil, or acetaminophen, Tylenol, if needed.
It sounds like you like some help with creating.
When to seek medical attention of burning. Burns larger than 3 inches. Burns on the face, hands, feet, genitals, or major joints. Signs of infection, pus, increased pain/swelling, fever. Electrical or chemical burns. Difficulty breathing, possible inhalation injury. Thank you for watching our YouTube channel and stay tuned for more similar information as we continue. Please subscribe and follow us.